In the ever-evolving landscape of women's health, a long overlooked but critically important subject is gaining renewed attention: hormone replacement therapy, HRT, for postmenopausal women. While menopause is a natural and inevitable part of life, its effects can be profound, ranging from hot flashes and sleep disturbances to more serious issues like bone loss, cognitive decline, and metabolic imbalance. For decades, HRT was seen as a powerful tool to manage these symptoms and even protect against chronic disease. However, a pivotal study in 2012, the Women's Health Initiative, WHO, cast a shadow over this once celebrated treatment, leading to widespread fear, regulatory caution, and a significant gap in both physician education and patient access. Now, after years of silence and misinformation, there is a growing movement among healthcare professionals to re-examine the role of HRT with a fresh perspective. The focus is not just on whether hormones are safe or effective, but how they can be used responsibly, safely, and tailored to each woman's unique needs. This shift is particularly relevant for women aged 53 and older, many of whom have been navigating the challenges of menopause without adequate support. As we delve deeper into this topic, it becomes clear that the key to successful hormone therapy lies not only in the hormones themselves but in understanding the intricate interplay between metabolism, aging, and overall health. The human body is a complex system where hormones act as messengers, influencing everything from mood and energy levels to bone density and cardiovascular function. After menopause, the production of estrogen and testosterone naturally declines, often leading to a cascade of physical and emotional changes. For many women, these changes are more than just inconvenient. They can disrupt daily life and impact long-term well-being. Yet, despite the potential benefits of HRT, many women remain hesitant to explore it due to lingering fears about safety, side effects, and age-related concerns. This hesitation is understandable, especially given the legacy of the WHO trial. Released in the early 2000s, the study initially suggested that HRT increased the risk of heart disease, stroke, and breast cancer. These findings sent shockwaves through the medical community and led to an immediate drop in HRT prescriptions. Over time, however, further analysis revealed that the risks were largely associated with the type and timing of hormone use. Specifically, the synthetic hormones and late initiation of therapy appeared to carry greater risks compared to bioidentical hormones and earlier administration. Despite these clarifications, the damage had already been done. Many providers stopped discussing HRT altogether, and patients were left without guidance. Today, the conversation around HRT is beginning to change. Medical experts are emphasizing the importance of personalized care, taking into account a woman's individual health history, symptom profile, and metabolic status. One of the most critical insights emerging from this new approach is the role of metabolic health in determining the success and safety of hormone therapy. Insulin resistance, a condition in which the body becomes less responsive to insulin, has been identified as a major factor that can interfere with hormone function. When insulin levels are high, the body tends to store fat-based hormones like estrogen, testosterone, and DHEA instead of converting them into their active forms. This means that even if a woman is receiving hormone replacement, she may not experience the full benefits if her metabolic health is compromised. This realization has led to a new paradigm in HRT, one that begins not with hormone prescriptions, but with a thorough assessment of a woman's metabolic state. Addressing issues like blood sugar balance, weight management, and inflammation before starting therapy can significantly improve outcomes and reduce risks. It also underscores the fact that HRT is not a one-size-fits-all solution. Rather, it must be approached as part of a holistic strategy for wellness. At the heart of this approach is dehydroepiandrosterone, or DHEA, a naturally occurring hormone produced by the adrenal glands. DHEA serves as a precursor to other sex hormones, including estrogen and testosterone, and plays a vital role in maintaining hormonal balance during and after menopause. Unlike prescription hormones, DHEA is available over the counter and can be applied topically, making it an accessible option for many women. Topical application, particularly on genital tissue, has shown promising results in improving vaginal dryness, sexual discomfort, and libido. Because it is a fat-soluble hormone, DHEA can be absorbed directly into the tissues where it's needed, bypassing the digestive system and liver, which reduces the risk of systemic side effects. As women begin to explore DHEA, they often discover that it provides a gentle yet effective way to address some of the most distressing symptoms of menopause. But DHEA is just the beginning. For those who require more comprehensive hormone support, the next step is often estradiol, the primary form of estrogen in the female body. Estradiol is preferred over conjugated equine estrogens, such as Premarin, because it matches the body's own hormone structure more closely. This makes it more compatible with estrogen receptors and allows for better absorption and utilization. Topical delivery methods, such as gels, patches, and vaginal rings, are particularly advantageous because they avoid first-pass liver metabolism, which can increase the risk of clotting and other adverse effects. While estradiol is essential for protecting bone density, supporting vaginal health, and reducing menopausal symptoms, it must be balanced with progesterone when a woman still has a uterus. Progesterone acts as a protective agent, preventing excessive thickening of the uterine lining and reducing the risk of endometrial cancer. Beyond its role in reproductive health, progesterone also offers valuable anti-inflammatory effects and supports healthy sleep patterns, two areas that are often disrupted during menopause. Micronized progesterone, a newer formulation that improves bioavailability, is increasingly being used in clinical practice due to its effectiveness and tolerability. One of the most overlooked aspects of hormone therapy is the role of testosterone in women's health. Although testosterone is often associated with male physiology, it plays a crucial role in female sexuality, energy, and overall vitality. Many women experience a significant drop in testosterone levels during menopause, which can lead to decreased libido, fatigue, and mood changes. Testosterone therapy, when administered appropriately, can help restore these lost functions and improve quality of life. Topical testosterone gels, while off-label for women, have demonstrated efficacy in clinical settings and offer a viable option for those seeking relief from low testosterone symptoms. The integration of testosterone into HRT regimens highlights the need for a more nuanced understanding of female hormones. Unlike in the past, when HRT was primarily focused on estrogen alone, modern approaches recognize the importance of restoring all key hormones in a balanced manner. This includes not only estrogen and progesterone but also testosterone, DHEA, and even thyroid hormones in certain cases. By addressing the entire hormonal spectrum, practitioners can provide more comprehensive and effective care for their patients. Another important consideration in HRT is the timing of initiation. Contrary to earlier misconceptions, recent research suggests that starting hormone therapy closer to the onset of menopause may offer greater protection against chronic diseases like osteoporosis and cognitive decline. This is particularly relevant for women who are metabolically healthy and do not have a history of cardiovascular disease. For older women, the decision to initiate or continue HRT requires careful evaluation of both risks and benefits. While age itself should not be a barrier to hormone therapy, it does necessitate a more cautious and individualized approach. Special considerations also arise for women who have undergone hysterectomy or have conditions like uterine prolapse. In the case of hysterectomy, estrogen-only therapy is generally considered appropriate since there is no longer a uterus to protect. However, even in these cases, balancing hormones remains essential to maintain optimal health. For women with uterine prolapse, the use of progesterone may need to be adjusted to accommodate anatomical changes and prevent complications. These nuances underscore the complexity of HRT and the need for close monitoring and regular follow-up. Despite the growing body of evidence supporting the benefits of HRT, many women still face barriers to accessing this treatment. These include outdated perceptions among healthcare providers, limited insurance coverage for certain formulations, and a lack of public awareness about the latest developments in hormone therapy. To overcome these challenges, it is essential to promote open dialogue between patients and physicians and to encourage ongoing education for healthcare professionals. Conferences, seminars, and online resources are playing a vital role in bridging this knowledge gap and empowering women to make informed decisions about their health. Ultimately, the goal of hormone replacement therapy is not merely to alleviate menopausal symptoms but to enhance overall well-being and longevity. By restoring hormonal balance, women can regain their vitality, improve their quality of life, and reduce the risk of chronic disease. This is a message that deserves to be heard loud and clear, not just in medical circles, but in communities across the country. As the field of women's health continues to evolve, it is time to embrace a more inclusive, evidence-based approach to hormone therapy, one that honors the complexity of the female body and the diverse needs of every woman. If you found this video informative and thought-provoking, don't forget to hit that like button and subscribe to the channel. Share it with someone who might benefit from a fresh perspective on menopause and hormone health, whether they're in their 50s or 70s, navigating symptoms, or simply curious about what's possible. Thanks for watching.